The constituency I'm running in is called Birmingham Edgbaston. It's a constituency that I currently serve as a physician. So I'm a neurology doctor at the local Queen Elizabeth Hospital, which is like the University of Birmingham Hospital. And I've also been a teacher and a lecturer at the University of Birmingham. So I've been kind of a public servant in that context. The connection runs quite deep. So when I moved to the UK at the age of 9, all the way back in the 90s, my parents and we moved into a house on a terraced house, sorry, on a road called Rotten Park Road, which is towards the north end of the constituency. I went to a state school there called the Lordswood Boys School, and that was my introduction to secondary schooling in the UK as a new immigrant. And my dad at that time worked at a hospital near the north as well, called this at that time Dudley Road Hospital, which is now called the City Hospital. So that's how I kind of started knowing this constituency. But recently, I've been serving it as a physician and a university lecturer, and I have a lot of friends and family that live in the area as well. So I know the area. I've been around. Currently, I don't live in the constituency currently, but I serve it. Inequality, undoubtedly. And that's my one word answer for you. The difference between the haves and the have-nots has grown even bigger since, especially, the financial crisis of 2008. But, that's going way back. But recently, even from COVID times onwards, you can kind of say. And this constituency is interesting because it's got a real diversity of populace. So it's got some of the poorest areas of Birmingham, and some of the richest, some of the smallest homes, some of the largest homes, estates, you can call them, that I've seen. So it's really diverse, and the same thing we said about the people there. There's like people from all walks of life live there, and it literally takes 5 minutes to get from one type of a lifestyle to another. And I think so. The biggest problem, the biggest theme, I think, in the constituency is that of inequality, and getting people to understand each other's problems and come up with shared solutions is, I think, the biggest challenge here. And the beauty of the independent approach is that that's what I'm essentially trying to do. I'm not here to sell a party line to anybody. I'm here to really, truly understand what constituents are, the difficulties that constituents are facing, and see if I can represent them in a way that often actually cuts across party lines, especially in a diverse constituency like this. Yeah, absolutely, absolutely. I mean, actually, what informed my thinking that way was actually watching a BBC program called the Climate Assembly or something like that, and they brought some local people together who were very disparate, not not much in common with each other, and they formed a citizens' assembly around climate change, and they got informed and engaged with the issues. And that was democratic participation like I've never seen before on TV, at least. Anyway, I was very kind of moved by that idea. And I always been very suspicious of. I used to be a member of the Labour Party, and I left after the Keir Starmer interview in LBC. But I was always becoming more suspicious of the party. The way they kind of, in my view anyway, they were unfairly treated Jeremy Corbyn, and then the way after that they moved away from the values that I believed in. Which are the true. So they became Labour in name only, essentially, and. So I was feeling very alienated. I talked to my local Labour Party group that I was a member of, and people were feeling equally despondent. And I thought, what's the point? Like, the whole point of a democratic exercise should be that the individuals at a local level who are a member of the committee should be able to have some input to the party, should be able to input into their policy making or their thinking. That wasn't happening. And I just compared that and contrasted that to the idea of the Citizens Assembly. And I know when I joined Reliance, I said to them, like, the point of me joining you guys and helping you is that I want not to set up a party or anything. I want to set up a coalition of independents who can represent the local communities and be listened to on issues like Gaza and whatnot, which, our MPs did not listen to us at all on. So that's where the idea really came about. And that's exactly the model I want to pursue. Because, look, I don't have a party behind me. I don't have any media. The media doesn't care, apart from yourself, perhaps, but the media doesn't really care who I am. There's no big donors behind me at all. It's just the donors are 100% local donors, 100% local. And we've, raised enough actually to run a successful campaign. So there's none of this hierarchy behind me. The only source of power or, you can say legitimacy I have are literally the people of Edgbaston. And I'm extremely pleased and, proud of that, actually. that local people, our campaign is 100% backed, supported, canvassed, door knocked, you name it, by leafleted by local people. And I'm so, so proud of that. And that's exactly how I want to keep it. The main opponents are we've got the Labour Party, who are the incumbents. This is Preet Gill. So she's, I think she was, she has, I don't think, I know, she has a shadow health and social care role for primary care and shadow health role for primary care and social care. So she's the incumbent. She's won the election twice on the Jeremy Corbyn manifesto. Um, and now the Keir Starmer's come, she's kind of U-turned on all her lines, and she's following the Keir Starmer line without any challenge to his, changing of the Labour Party. But also she's, been, I mean, she's quite outspoken on issues affecting the Sikh community, and obviously the Sikh community has a history of being persecuted in India, and by obviously by British colonial rule as well, with the Jallianwala Bagh massacre, for example, being a key example. So, one would think that she would be someone who speaks out naturally on the issue of the atrocities in Gaza, but wasn't the case. She abstained from a vote on ceasefire, and that really angered a lot of people. And a lot of the people who joined my team actually are also ex-Labour colleagues who went to visit her, and she was very rude to them. I'm told. I mean, I don't know this from firsthand, but I'm told that she was quite rude, and she like got rid of them from her office through a security guard apparently. So basically, it wasn't a positive experience. So she's like the main incumbent, and a lot of people are, because of that issue, but also other issues, they feel that she's not listening to them. Again, I don't know this because I physically didn't visit her, but this is what people have told me. Then there's the Conservative chap. He is Ashwin Sangha. He's a nice chap, really. I've talked to him. But he is Andy Street, the ex-mayor of Birmingham's right-hand man of days gone by. So he was the communications director and I think chief mouthpiece for the for the Andy Street mayoral operations. And yeah, he's a good chap. And his kind of approach is think local. If you want a local, independently minded MP, vote us. And there's no mention of the Conservatives, no branding of the Conservatives until you get to the very corner of his website or his letter. And there's a little tree there, the old David Cameron tree. So people, I think, aren't stupid. So he's not doing very well because of his affiliation to essentially Rishi Sunak. I mean, a vote for him is a vote for Rishi Sunak, no matter how independent he poses himself to be. So I'm I'm the only genuine independent here. And then we've got Liberal Democrats, really nice chap, Colin, very, very nice chap. He's running for the Lib Dems. And then there's Nicola, who's running for the Greens. Again, very nice lady. And that's it. There's a Reform candidate who I've never met, never seen at any of the hustings or anything. And that's our lot, really. There's 6 of us all together. The fact that we are completely locally based, as I've said, and we are taking issues that actually cut across party lines and being able to represent them. So in our constituency, obviously, inequality is a huge concern in the poorer areas. So we're pushing for ending austerity. We're pushing for end to the 2-child benefit cap for free school meals. But at the same time, the middle class is concerned that they are taking too much of the tax burden. They're bearing the brunt of too much of the tax burden, and I actually agree with that. So therefore, I'm kind of more lobbying for a wealth tax on the super wealthy, and a reconfiguration of the corporate gains tax, for example, to raise tax receipts. At the same time, we've got students who want to have free tuition, like no tuition fees. So I'm representing that issue. There's parents, middle class parents, who don't want to pay 20% VAT for their education in private schools for their kids. So there's such demand for that. I've incorporated that into my policy platform as well. And this is, again, you can argue that cuts across party lines. But actually, on that specific issue, my defense for that issue is that, and I know this from actually meeting people, not everybody who's sending their kids to school is actually well off. There's some people who really actually, working not the highest paid jobs, and they're really stretching themselves to send their kids to school. There's a few people who are sending their kids to school because they have special educational needs, and the state sector can't provide for them, and they can't get a timely. I'm working in the neurology department. Our waiting list is like 3-4 years long. They can't get a timely diagnosis, therefore they can't get a timely education and healthcare plan, and therefore they can't get timely input from the council on the facilities that they need, and the children are really suffering educationally and also in the way they're being looked after. And the private sector is actually able to offer them something the state sector isn't. So for those reasons, I think it's actually the correct position for me to take. So yeah, that's an example of how we are different from the others. We're cutting across party lines. We're free to work with the community, come up with policy positions, get them ratified really by the community and all the activists that are with us, and present that offer to the public. I've spent some time thinking about my positions, presenting it to the public actually, and in Edgbaston particularly, and getting their feedback and then updating these documents. As I spent a lot of time doing that. You can have a look. But yeah, like number I remind myself, number 2 commitment that I've got here is rebuilding and investing in our communities. And one key component of that is actually funding education. So I'm a governor at 2 schools. I know how deep the problems of the small budget cut. There's teachers leaving in their droves from our schools because they can't get the appropriate pay. It's very much actually a mirror. It's a facsimile, can I say, of like the healthcare system in a way, because same thing there. Overstretched nurses, overstretched physicians and doctors, not being paid enough, really tough working conditions on top, the very long hours, and the financial remunerations like nowhere near what it should be. Also, well, in itself it's not, but also compounded by the fact that it's the pay's been frozen compared to inflation, and that's been since Theresa May kind of got involved really, and so the inflation shot up, pay's been flatlining, so people are really struggling actually, and yeah. So my education policy is as in line with what the NEU is saying. 5% of GDP should be diverted towards education. I think at the moment it's 4.2 or 4.4%. So it's a 0.6% rise that they're asking for. And I think it's completely appropriate. But also I think on top of that, I'm asking for our teachers to be paid properly and respected. And the way I think that can be achieved is actually by working with the teachers' unions to meet the demands. And I've got a similar position for healthcare because I'm a member of the BMA myself. And currently we're obviously taking industrial action in the NHS. And I think unions aren't there to cause disruption for the sake of it, because we know that after the strike is over, we've got to go back to the hospitals and actually work through the caseloads that have been building up. It's not as if the work goes away. We just work gets more concentrated. But the unions are in a position to understand what the members need, and they're not asking for a king's ransom. They're just asking for pay rise in line with inflation. And let's not forget, in the private sector, the pay rise has been above inflation often. And that's not considered inflationary. But when the public sector demands, at least keeping up with inflation, Rishi Sunak and co come out and say, "Oh, this is going to be really inflationary. Can't do this." So yeah. So I'm in terms of education, I'm fighting for 5% GDP and meeting the demands of the teaching unions. I hate to sound like a broken record, but it's funding. Undoubtedly, it's funding. Look, since the 2008 financial crisis, the NHS has faced about a £60 billion shortfall in its budget overall until last year. And that was not me saying it, it's a report by the King's Fund that said that. On top of that, looking at the new manifesto promises made by both the Tories and the Labour government, the Nuffield Trust has said that's not even going to stretch to pay the existing salaries of the staff, let alone all the new staff they want to hire. The Health Foundation has said that over the next 5 years, the next parliament, we can expect the budget chasm to go from 60 billion to add another 40 billion approximately on top. So we're looking at £100 billion hole here in finances that need to be funded. So undoubtedly it's that's the huge issue. And that links back to the staff, the low morale of the staff, the poor pay, the incredibly difficult working conditions, because we have to work with technology from the 1970s, bleepers and bleeping away. We have we don't have our own mobile phones, for example. Which organization that is so heavily reliant on telephone conversations would not provide at least a device to its own staff, to make communications easier? It's really quite awful. Our email systems are decrepit, I can go on. But yeah, so I think the ultimate problem here is funding. And if you look at the NHS, right, so we spend $3,000 per head in the NHS. Compare that to Germany that spends $7,000 per head. So our spending is one of the lowest in the OECD nations, right? Our scanners, number of scanners, we've got 16 scanners per million in this country. Japan has nearly 10 times, 166 per million, right? And in my specialty, neurology, we are all dependent on the scan to make the diagnosis. So not having appropriate capital resources, because the capital expenditure has been very low in the NHS, not having the appropriate physical equipment really does hamper the work that we do in the NHS, and it shows in the outcomes and the satisfaction of patients in the NHS. So funding is the most important thing. But there are other things, of course. We've got to focus on staff. We've got to, like for example, like GPs. GPs are unemployed right now. There's in this system where you can't get an appointment with the GP. There are a lot of GPs who can't find a job. I mean, what's going on there? So we need to look at the structural factors, how we're actually hiring, how we have healthcare systems organized. We need to depoliticize NHS funding rather than every now, 5, 6 years, new government coming in, top-down reform, and we need to get away from that. We need to have some sort of a depoliticized view of NHS funding and if we want, that is, a system that's free at the point of use. We have to invest in it. We have to be prepared to spend in it. We have to be prepared to move it beyond just party politics. And finally, we have to resist privatization in the NHS as well. That's another kind of important thing for me. Because anytime the NHS has been, particularly the NHS has been exposed to large private firms that don't add value and actually reduce the NHS's capacity, we've lost out. The taxpayers have to pay the bill. Circle's a great example of that. Babylon's an example of that. And now Palantir has been given like all of our, it's an extractive US spy tech company. It's been given all of our data for who knows what, very obscure contract. And undoubtedly that they're going to make money out of that and we're going to be the losers as the public. So I think we should resist privatization. Oh, no, not at all. I mean, West Streeting said, that middle-class lefties like me should keep our mouth shut and let him use the private sector as and when needed. I mean, look, to be honest with you, we should do a pilot, right? And if in the pilot it's demonstrable using like robust health economic analysis that the private companies are providing more benefit for less cost and not sapping away the NHS's capacity by cream skimming all the easy stuff, fine. I don't have a problem. I mean, I would like to set up a company that provides value to the NHS like that. The problem I have is, like people reach out to the private sector like they did with COVID, for example, as if it's some solution. And what then happens is you waste 70 billion pounds on a test and trace system that has absolutely zero impact on COVID cases, right? We spend God knows how many billions on an app, which is promised as a magical, solution, and it's complete waste of money, complete, failure. So that's my problem. My problem is not going through the thought process and just lurching to privatization as a solution without thinking about the long and short-term costs. I think this is my problem. The war on Gaza and the war on Palestinians, should I say, it's a clear case. It's clear as hell, especially if you're a human rights lawyer like Keir Starmer, right? It's clear that it's a case of ethnic cleansing, war crimes, and frankly, genocide. I know the ICJ is going to take years to make the decision, but it's pretty obvious that it is. But the suffering hasn't started like since October. The suffering's been going on for 75 years. Before the 7th of October attacks, hundreds of Palestinians were killed, hundreds of those children, and the word didn't make a peep. Afterwards, 40,000 have been murdered, 20,000 of them are children, and we speak out against it. We're the extremists. We organize against it. We're the hate marches and the mobs, and it's really sickening. And the basic question I have for our political establishment is, what do the Palestinians have to do to make us acknowledge that they also are human beings? What do they have to do? They parade their dead children with body parts hanging off. It doesn't wake up our political classes. Okay, we see images of shriveled, starving, emaciated babies in their mother's hands, crying out for milk, and their mothers in tears giving water as a substitute. It doesn't wake up our political classes, right? And then we see war crime after war crime, clear, like the ITV, segment that was done, which showed a citizen waving a white flag being shot We've got video footage of mothers and children being shot at the entrance to hospitals. We've got first-hand accounts of babies being shot in the sniped in the head. We've got the case of Hind Rajab. We've got the case of, so many. I don't even know where to start naming them, right? All of these war crimes. And still our political classes are not awake to the atrocities that have been committed by the so-called allies. So what do the Palestinians have to do to make us realize they are human beings? What do the Palestinians have to do to make us realize their lives matter and that they are suffering? How much do they have to suffer before we say, you know what, you are suffering? It's grotesque. It's really grotesque. So I'm sickened and appalled. It makes me sick. It makes me really sick. It's inhumane. It's inhumane. I mean, they speak out against, with the Conservative Party, right? You show them war crimes and they say, oh, we're not judges. We can't make a decision. When the actual judges at the ICJ and the ICC adjudicate against Israel, immediately they're out to say, yeah, you're wrong. When it comes to Ukraine, they're very quick to judge. Oh, yeah, that's a human right, including Keir Starmer. He's on video having said that, isn't he? That very quickly, Russia, yeah, that's war crimes. And for Gaza, well, I don't know. And now even the ICC, ICJ have said something. Keir Starmer, the human rights lawyer, can't actually come out and physically utter from his mouth any words of support for the Palestinians or for the ICC and the ICJ. He's putting David Lammy forward so he can plausibly deny that he was ever involved to the Israel lobby. Undoubtedly, Gaza is part of it. Undoubtedly, Gaza is part of that. To see the political parties, not be moved. They were moved, rightly so, at the murder of Israeli babies and children, right? No child, no unarmed person should be killed. And they were rightly, moved by that. But when it was, very quickly it was apparent that, as in previous attacks on Gaza and the Palestinian civilization, a population, should I say, sorry, when it became clear that collective punishment was happening, you've got to apply international law and human rights equally. I was waiting for them to say, I was like, yes, here you go, Keir Starmer, here's his opportunity. And what does he say? He goes on to LBC and says, right, you know what? They have the right to withhold power and water. And then he tried to defend that by sending his lackeys out. And when the pressure got too much, suddenly he did a U-turn. And now you see all of these guys doing U-turns, right? So like Pete Gill, our local MP, she's coming out and she's saying, oh, you know what? I support ceasefire now. And she's giving us leaflets in the areas that we canvass to counter our activism. She's giving leaflets to the residents saying, I've always been pro-Palestine. I'm a friend of Palestine. Yeah, Palestinian rights all the way. And today she said, what did she say to someone? She said, yeah, we're going to sanction Israel, she said, I think. And she said that on the doorstep. It's not anywhere in their manifesto. I don't know which authority she was speaking from. So it's incredibly disappointing. Even now, when they've been forced to change their position, like I said, they're not talking about sanctions. They're not talking about, diplomatic isolation. They're not talking about recognition of a Palestinian state. They kind of mention it in passing, but it wasn't quite what we thought it was. So it's all very disappointing and mild and meek and timid from the Labour Party. Other issues, though, apart from that, NHS, of course, because in my department, 3-4 year waiting list is intolerable. Seeing patients after 16 hours of waiting when they're suffering with really bad, like acute conditions, intolerable. Taking my own kid to A&E to get his oxygen level checked because I thought he had croup or something. Had to wait 8 hours as with a baby in hand. This is atrocious. So that, and again, I was waiting for the Labour Party. Here we go. They're going to promise something bold and unique. Nothing. It's even worse than the height of Tory austerity. And then same thing, green politics. I'm huge on green politics. I've got like electric cars, solar panels, insulation, all that kind of stuff, right? So I was like, here we go. An economic solution to this problem, which is going to improve everybody's lives and cheapen everybody's bills. I was like, finally, £28 billion package. Yes, let's go. Again, that was U-turn and dropped as well. Really, the Labour Party don't represent anything. So one of the main motivations, yes, is Gaza, but also it's what forced me to leave the Labour Party, realizing that actually there's no one defending from the mainstream parties defending, a truly progressive offering. I know the Green Party are, to be fair, and the Lib Dems are not as bad as others, but in Birmingham they seem to have very little interest, and they don't have any solid operations on the ground either. A lot of the candidates are paper candidates in Birmingham. So I thought this is our opportunity. We've got to get together and do something. I'm not interested in being Parliament's representative to the people. I want to be the people's representative to the parliament. I'm asking people to think differently. Think about what it is that an independent candidate can offer them, right? We can pick up issues that cut across party lines, and we're listening to you. We're like, your people I've met on the doorsteps have said, no politician or political party has ever come to our door, ever, 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 in the 30 years they've lived there. So we want to listen to people. It's been the biggest pleasure actually of this campaign, listening to people. I listen to people anyway as part of my job as a physician, but this is beyond the clinic. This is actually understanding problems from a different, sphere, different paradigm, and just listening to people complain about their issues that other people don't listen to. I want to hear all of that. I want to absorb all of that, and I want to make a difference through representing them in Parliament. And I'm just asking people to think differently. Think about the value proposition an independent can offer. Ignore what you've been trained to about the, reflexively voting for one party or the other. Think different, think independent, and vote Dr. Ammar for Edgbaston. My experience has been people aren't talking about green politics as I thought they would. All the hustings and everything. Nobody's picked up on the climate crisis. This is an existential threat to us, and I wish that that was brought up more. I wish people would appreciate that Palestinians are human beings. I wish people would invest in the kind of society we want to build. It's not cheap, If you want to keep the billion, like, I don't want to use Bernie Sanders' line, but if you want to keep like the billionaires and the multinationals happy, fine. Then tell everybody you got to go get insurance, and we got to live with a health insurance system like America. But I think people don't want that. People want a society that respects everybody, where the most vulnerable are looked after, and where we can have a shared understanding. And that can't be done unless we tackle inequality and the disparities in our society. And that's what I want to do. I will do what any backbencher does as an independent MP. I will advocate for, I will speak out for, and I will propose, if I'm elected, I'll propose the legislations or whatever movements, motions, whatever you have to kind of push on this issue. Look, we need a record investment. Again, I don't want to just constantly talk about money, but we do need an investment program in the green transition. The reason I call it as an investment is because, yes, there's so all of my policies are asking for big upfront spending packages, right? Undoubtedly. Yes, it's expensive. It can be taxed with, like I said, wealth tax, corporate gains taxes, all, non-dom tax avoidance, all of this can be looked into. But this investment is going to pay off, because the investment in the health system is costing us £45 billion a year because of sickness in our economy. And that's largely due to huge waiting lists, right? Similarly with the planet, like if we invest in, I'm surprised, so I drive electric cars, and I'm so surprised at having solar panels. I can either charge my car completely free of cost on sunshine, and I'm driving around emitting sunshine as my exhaust, or it's like wind power, which I purchased from Octopus. And Octopus charged me 7p a kilowatt hour to charge at night, which means that my car, I've got a Nissan Leaf, and that fills up for £1.50, £1.60 or something. And in that I can do 160 miles. It's like an economic no-brainer. Yes, it cost me £600 to install the charging point and all that kind of stuff. Yes, it cost me money to get the solar panels up. But the point is, the investment you put in, you get so much back. And in the long run, think of the long run. We're all going to save a lot of money if we can make the appropriate investments. If we don't, we keep on putting sticking plasters on, then things like COVID come up, and then you suddenly balloon with a big bunch of borrowing, and you waste it on your mates or on private companies giving you consultation fees. And it's a wasteful way actually of being. So we need to realize what's important, invest in that. And yes, part of that is investing in the environment in a record green investment program. We need to reduce our carbon emissions and look for net zero, and then absolute zero, which is again going to pay us economic dividends in the short and long run. We need to insulate homes. Yes, it's going to be expensive. I insulated this house, right? And my bills have plummeted since then, completely plummeted. It's the best thing I did, the best couple of £1,000s I spent. We need to protect our rivers and seas. Again, whatever it takes, let's claw the power away from private water companies. Natural monopolies need to be nationalized. And I think we urgently need to introduce a deposit return scheme. I know again that's going to take a bit of investment to set up, but the scourge of like drink cans and bottles everywhere that you go, it'll be mopped up by this policy. So yeah, it's very important for me, the saving our planet piece.